Good day, and welcome to another video of Counseling 5480 Counseling Diagnosis and Treatment Planning course. In this video, we're going to talk about gender dysphoria. Without looking ahead, I want you to take a minute and to pause the video and think of this question. What comes up for you when you see this diagnosis? After that brief reflection, I would encourage you to pause this video and click on this YouTube video link on the slide to hear what this diagnosis mean for some of the transgender people. Well, I hope you find that video to be helpful. So gender dysphoria is basically the incongruence of the biological gender versus the gender an individual is expressing in their everyday life. So the word dysphoria means the state of being distressed. And you can understand this type of distress in two layers. Apparently, the individual who has this diagnosis would be distressed by the incongruence of what they are assigned, biologically and what they're experiencing internally. The second layer of this distress comes from a place of not being able to access services for gender reassignment. And this is, according to my experience, especially more common among children and adolescents, because if they live in a family where the parents are more or less understanding, they will feel extremely limited. Because children, adolescents, minors don't have much power, right? The parents are all over them. So they may usually feel invalidated. They were forced to do something that they don't feel natural at all. Can you think of any of examples in your life? And this diagnosis can be given to individuals across their lifespan. There are actually two codes for this diagnosis. The first one, F64.2, is the one for gender dysphoria in children, and then F64.1 is for gender dysphoria in both adolescents and adults. To check out the full criteria, you can turn to page 452 in DSM-5. When it comes to diagnosis, something to pay attention to is that for these two codes, even though the duration is the same, the required duration is the same, which is 6 months, the subcriteria, or aka the so-called symptoms, are different. So for gender dysphoria in children, individuals have to meet at least 6 out of 8 subcriteria, according to criterion A. And then in gender dysphoria in adolescents and adults, individuals only need to meet 2 out of 6 subcriteria, according to the criterion A. So I know many of you probably really against diagnosing people, especially, and you probably feel that this diagnosis is especially associated with stigma or even creating some stigma. And so definitely, I hear all of that. I understand that this disorder almost seems like a label that by no means is going to create or limit any kind of stigma. However, as therapists, let's try to look at this diagnosis in a more positive way. So for many transgender folks, this diagnosis is necessary, right, in order for them to access any kind of services, any kind of like medical services, such as the hormone therapy and the surgery, the gender reassignment surgery. But as many of you know, not all trans folks have to go through the surgery, and I want to be very clear about that. As a matter of fact, one of the responsibilities of us counselors, is to help the client to figure out what options are there for them and to also help them to evaluate their readiness in getting through that medical transition. And if they decide to not go that way, how can we support them just to live their lives as who they are? And this may include change the way they dress, change their hairstyle, change their name, their preferred name, the way they talk, the language. Language can be very powerful. I mean, English is my second language, but I still feel like English is it's not too much sensitive to gender compared to some of the languages I'm familiar with, like Japanese or Korean, because in those language, um, male and female, they really talk differently. So again, as counselors, we really need to take those cultural considerations into our like when we're working with this kind of population. And finally, just FYI, this diagnosis has been formally known as gender identity disorder in the previous DSM edition, which is DSM-4. The gender unicorn. I wonder if anyone have seen this before. This is a graph that has done a really good job in helping you explaining the difference between gender identity, gender expression, and many other concepts. So this is a graph that I'd like to share with especially my teens, clients, and sometimes even with their family members, especially those who have a transgender children, or maybe who are confused or in a process of exploring their gender and sex identities. So if you want to have access to this graph and many other wonderful resources, I encourage you to go to transstudent.org/gender. I find that website to be very user-friendly and it's very helpful. So let's look at this graph. So there are 5 different concepts with colorful symbols and everything. Let's look at each one of them. The first one is gender identity, which basically means who we are. So it's individual's internal sense of being either male, female, neither of those, both, or another gender or genders. So for transgender people, their sex assigned at birth and their own internal sense of gender identity are not the same. And the second one, gender expression, refers to how we look, right? So they refers to the physical expression of one's gender identity through the way we dress, how we do our hairstyle, the voice, the body shape, the gestures, posture, etc. And so most transgender folks seek to make their gender expression match their gender identity rather than their sex assigned at birth. So what is sex assigned at birth? This is the assignment and the classification of people, usually like medical classification of people as, either male, female, intersex, or another sex based on a combination of anatomy, hormones, and chromosomes. So specifically, intersex people are those who were born with productive or sexual anatomy that doesn't seem to fit the typical definitions of female or male. And so finally, physically or emotionally attracted to. These two things basically means how individuals are either sexually or emotionally oriented to in their romantic lives. So how can we use this diagnosis in favor of our clients? In other words, are there any benefits of this diagnosis? We can look at this in 2 ways. The first one is, as we all know, in order for us to get reimbursement from the insurance company, it's almost always the case that a diagnosis is necessary, especially for those who decide to access to who wants to have access for the medical transition therapy. So this diagnosis can provide them actual financial help. The second way to look at this is for anyone who want to get the gender affirmation surgeries or gender affirming surgery, a letter from a letter of referral from a qualified mental health professional, which could be you in the future, is a must. And in that letter, this diagnosis needs to be documented. So even for individuals without insurance, they want to do the surgery, then this diagnosis is still a must. Can you think of any other benefits, potential benefits of this diagnosis? How about any negative aspects of this diagnosis within a manual for mental disorders? This is such a powerful manual. I want you to kind of take some time and think about it. So how can we as mental health professionals help transgender folks? As the opposite of conversion therapy, affirmative therapy is the main therapy for LGBTQIA+ individuals, because this approach is committed to empower the members of LGBTQIA+ in their relationships and their lives. In this therapy, therapists actually honor the struggles that they've experienced, and therapists also aim at finding effective ways to help them overcome their daily challenges. There are many training programs or workshops or webinars on affirmative therapy, such as ACA. I will share the link to the ACA course on Canvas, but there's also PESI. There are many other like special programs which provide continuing education. So the resources is there. If that's something that you're passionate about, you can look them up, and I'd be glad to look over the resources that you found as well. Something else I'd like to share with you is the World Professional Association for Transgender Health guidelines. I also downloaded and uploaded this PDF to Canvas, so you should be able to access to it. But basically, this is a guideline that aim at, I'm quoting from the manual, to provide clinical guidance for health professionals to assist transsexual, transgender, and gender nonconforming people with safe and effective pathways to achieving lasting personal comfort with their gendered selves in order to maximize their overall health, psychological well-being, as well as self-fulfillment. So again, if you're really passionate about helping gender minority population, I highly recommend you to at least save this document for future help, or whenever you want to look at it in the future. Another thing that we can do, especially with gender minority people, is we help them to kind of explore their resilience, because, as we all know, their struggles are huge. So how can we kind of empower them, as well as build up that resilience? How can we help them to see their inner strengths that they already had? Like many minority groups, transgender folks are also tend to be more isolated. Their situation is more isolating. So the connection to social support is really, really important. And this doesn't not necessarily mean any like face-to-face groups. It could mean any virtual groups, right? This is a digital century. So there are social media groups. There are other apps where people can establish a community. But before you recommend anything out to your clients, making sure you understand how each community works. Make sure you try it out first. Make sure you know that the resources are valid before you recommend to any of your clients. Group counseling can be especially helpful with this population. Maybe not even group counseling, like a peer support group is even more helpful because again, we're trying to establish that social support component, and people in groups are easier to kind of learn from each other, get inspired from each other, getting strength from the community, um, things like that. What other treatment options have you heard of, or maybe you've thought about it? I'd be glad to learn about your idea too. And finally, I have some resources that I'd like to share with you. If you are big with some publications, some standards, some guidelines, competencies for counseling, then I recommend you to check out the first two resources. They're both publications of ACA. They are published on the American Counseling Association website. So those are pretty good resources. If you are big in supporting transgender family members, because for some parents it was almost like a grieving process, and they were confused, especially with those who have strong religious beliefs. It could be extremely hard for them, right? And so psychoeducation could always help. So I provide some resources there for you to share with them. And if you're big on like self-help books or just some quick reads, there are books for trans and non-binary youth. There's also this one book written by Iris Gottlieb. It's called Seeing Gender. It's a very nice book. And there are some other transgender resources at the bottom. I also encourage you to bring the resources that you are familiar with to class, or maybe just share within your groups with your peers, so that we can all learn more about how we can better help this population. At this point, you have reached the end of this lecture, and so I hope you enjoy the content, and I look forward to discuss this topic in class. As always, please don't hesitate to email me, to talk to me in my office hours for any questions that you may have. I'll see you in the next lecture.